The Art of Life Foundation is a non-profit organization established in September 2002 by Chief Mrs. Taiwo in memory of her beloved 24-year-old daughter, Abioye Aronke Taiwo, who died in a car accident on the 19th of April 2002.
The Art of Life Foundation was established to immortalize my daughter, Abioye Aronke Taiwo. It's actually a synonym of her name, A-A-R-T, Art.
Since its establishment, the Art of Life Foundation has been committed to advancing the virtues of love, compassion, and sensitivity among all Nigerians through diverse life-transforming projects.
The first couple of years, we developed a program called Against All Odds. We went on a search for young people under the age of 35 who had overcome difficulties and survived against all odds, so that their story could be told and they would serve as inspiration for young people.
Probably one of the first people to have a reality show. So we are talking about when the early years of Asha, of P-Square, of Two-Face, they were all part of the early years of Art of Life Foundation.
Inspired by the life of her late daughter, Abioye Aronke Taiwo, Chief Mrs. Taiwo shortly thereafter became a national change agent, and till date, she has not relented in her efforts to influence positive changes in her environment.
So during grief process, the first thing you go through is denial, is doubt, is regret. By the end of the 7 grief stage, you accept what has happened. Some people, even though they might accept what happened to them, they might go into depression. But for Chief Mrs. Taiwo, because of the love she has for her daughter, for her child, she has transferred that love into creating Art's Foundation.
Chief Mrs. Taiwo has traditionally lit up hope in the hearts of family, friends, and residents of Ikeja by lighting up the Peace Garden every 3rd December as a memorial to her late daughter. Traumatized and bereaved persons do not know what to do or where to go for counseling. Some seek comfort in addictions or, even worse, consider suicide.
I got very disturbed last year when I heard of a series of suicides. And I mean, the facts are there. 80% of Lagosians, of Nigerians, are clinically depressed. They're not showing it, but they are clinically depressed.
Chief Mrs. Taiwo, however, managed to transform her experience into something that will capture the essence of her beloved daughter whilst helping others. She and her team have conceived a groundbreaking health intervention program that could revolutionize the way we care for the bereaved and the traumatized.
We're setting up a call center that will counsel 24 hours people with all sorts of trauma, suicidal thoughts.
This is quite important, especially in a place like Lagos, where we have a lot of people who are stressed, who have been bereaved, who are having issues that need serious counseling.
So what a call center like this does for any kind of trauma is that it gives that opportunity to unburden.
The most important thing is to have somebody to talk to, somebody to relate to, somebody to tell you at that particular moment that there is hope.
Indeed, it takes one willing heart to initiate change, but more hands are required to create a revolution. Dr. Rotimi Koka and Professor Abiodun Adewuya, both consultant psychiatrists and lecturers with the Department of Behavioral Medicine at the Lagos State University Teaching Hospital, are entrusted with the responsibility, along with other professors, to train selected graduates to become professional grief counselors.
In this department, we have actually trained many counselors for the Art of Life. I have personally been to Kano to train some counselors too for Aart of Life. So it's an active collaboration between our department in this college with the Aart of Life.
Mental health workers or the grief counselors have their own way of assessing, because there is, I wouldn't call it a checklist, but there are some symptoms in which the client who is talking to the counselor will have. And we expect that during recovery phases, those symptoms should be disappearing one by one. So we expect the counselor to ask.
As a counselor, you have to be able to communicate very well, and you should be able to listen. And also you have to maintain confidentiality, because for someone to call you, the person wants to confide in you, to also know that yes, the secret is kept.
People who are in pain, have been raped, have thought of suicides, the first things that they want to hear is that what I'm saying to you is totally confidential. So the anonymity and confidential part of it is what makes it so effective.
Not only has she reached out to helpful professionals in related medical fields, her passion to make the call center at par with international standards has made her to go as far as involving the government of Lagos State.
Our primary objective as a state is to create as much awareness, as much education, advocate for help for people who have mental health disorders. And Aart of Life has been a very active partner in helping us drive this process.
It's also a partnership with Vision to Go, which is an international charity. And we're linking it to the NHS. The British High Commission is involved.
I'm Jamie Good, and I'm the head of a British charity and social enterprise called Vision to Go. And we're very proud to be a key partner of Aart of Life and all the other stakeholders in the proposed mental health help centre. We've put forward a syllabus, and we've managed to get the support of some key experts who are going to come and assist in the training of these pioneering phone operators to ensure that they are the most possibly qualified that they can be when they begin to receive calls.
Although significant work has been done recently by the Ministry of Health to raise awareness about suicide prevention, the Aart of Life innovative intervention might just be the light of hope for this social issue.
It would have been difficult or almost impossible for the Ministry of Health to take it up and bankroll it by itself. But luckily, Lagos State is a forward-thinking state. There's the Lagos State Employment Trust Fund that has created thousands of jobs for graduates, people on the streets, and they are partnering with us in this particular project.
The Lagos State Employment Trust Fund was set up by the Lagos State government in 2016 by Governor Akinwumi Ambode to provide financial support that enables job creation across the state. We're very keen to partner with Aart Foundation, especially as it relates to mental health assistance. And so we're partnering to set up a mental health call center through which people with mental health issues can be provided with first-level support, which is a critical part of helping such people.
It's not a rocket science on how to set it up. You need Lagos State has already given us a line to connect. You have people that will be there 24 hours, obviously on shifts. Counselors are being absorbed by Lagos State to become their staff. So the Lagos State Graduate Employment Fund.
It's a double bottom line, I think, outcome for us. On one hand, we're supporting people struggling with mental health issues, but also on the other hand, we're creating jobs because this call center will be manned by people who otherwise would not have had jobs at hand.
Lagos State is providing the payment for the staff. I mean, there's a call center itself. There's the cost of providing that. We have not yet had a GSM partner like we had before.
Back in the UK, to really push for support from our UK-based partners, big NGO organisations here, as well as the Prince's Trust and Mind Charity and the UK NHS as well, with the possibility that at some point in the future we will even be hiring even more operators as we outsource some of the UK's mental health problems to employment call centres in Lagos. So it's a very, very exciting time, and I can only ask that everyone gives very, very, very generously, because it has been an incredible year. But next year is truly going to be the revolutionary year for mental health in Lagos and in Nigeria.
When I was a young child, I remember reading somewhere that most human beings only achieve 10% of their talent. I thought, how sad. I said to myself, I'm determined to at least get to 75%, and I'm on my way there.
The darkest night produces the brightest star. To the resolute, hope remains in the darkest moment. Like Chief Mrs. Taiwo and the Art of Life Foundation, with a positive view of life, a commitment to offer a helping hand to those in need, we can restore hope, living for good to do good.